Thank you all for having me tonight. It's really an honor to come and speak with you all. I was talking with Denise, and you guys are a really, really busy, hardworking group of women. Not only are you busy in your own personal lives, but my goodness, the work that you all do for the community is just top of the line. I've never heard of so much community activism in such a group of women who are already busy in their lives. So thank you for what you are doing for not just Children's Bureau, but for the community at large. You know, right before I came over here, I knew that Children's Bureau and the Junior League had a long association with one another, but I didn't realize how far back it actually had gone. I was talking to our CEO, Alex Morales, who some of you might know, and he shared with me that one of your past, I guess you call him your president of the Junior League, was a lady named Lucy Taylor, and she was the president back in the late 70s, early 80s. And at that time, you all had an advocacy training program that you offered your membership. And Lucy was very keen. She was also the chairman of the board of Children's Bureau at that time, and she's very keen on trying to broaden that advocacy program outside your membership. And so she recruited Alex, who was not the CEO at the time, and a few other of our senior managers for you all to use as guinea pigs. And Alex said it was one of the best advocacy training programs he's ever attended, and he has used those skills that he learned from you all throughout his career. So that's pretty high praise, I think. I want to thank you all for the time that you all have spent at Children's Bureau. Some of you probably in this room have worked in the reading program that Denise was speaking about. We all know the importance of reading to children, especially in those early developmental years. And so the time that you spend with them is not only important in helping them develop the skills they need to be ready for school and to do well in school, but it also is a great sharing experience with the families who don't realize the importance of reading to their children. So not only are you helping those children actually learning something, you're actually helping families learn to be better families, parents to be better parents. So thank you very much for that. I also know that I'm going to be leaving here tonight with a car full of toys that you all have donated for our toy boutique coming up in December. It's a fabulous program. I don't know if you know about it, but we actually take the toys and we put them in a room. The families come with their kids. The kids go off and play and do arts and crafts and have snacks and whatnot. And the parents can actually shop for the toys and select toys for their kids, which they then later take to a wrapping station, and we wrap the presents for them. So they really get to go home with a present, and instead of just being charity, it is charity, but it's charity with dignity. So the kids actually get a present that seems like it came from mom and dad. So thank you all for that. Do any of you have children? Show of hands. Did any of your children come with instruction booklets? No, they don't. They don't come with instruction booklets, or at least mine didn't come with instruction booklets. You know, the thing we know about parenting is you parent kind of as you were parented. So if you were fortunate enough to be born into a family where you had loving, nurturing parents that could afford to provide for you and your needs, chances are you yourself are going to emulate that role model and become good parents for your children. Sadly, and conversely, the opposite is true. So if you were born to parents who were unable to care for you or were abusive and neglectful, the chance of you repeating that cycle is increased. And that's where Children's Bureau comes in. Last year in Los Angeles and Orange County, there were over 204,000 cases reported of child abuse and neglect. It becomes even more horrific when you understand that for every one case that is reported, there are 3 that are not. That's just in 2 counties in one state in this country. So you can see that it is an epidemic problem that needs a solution, and we can have a solution, and that's where the Children's Bureau comes in. As Denise shared with you, Children's Bureau has been around for 108 years. So we have a little bit of experience in dealing with this, but we've adapted that experience and changed over time, and we are constantly studying ways to improve our work. Our primary mission is prevention, but we can't always prevent the harm. So through our mental health services and our foster care and adoption services, we can provide aid to families in great distress. You have to understand what causes child abuse, and one of the things that we've learned is that poverty is a big contributor to that. And as I said earlier, if you were parented by abusive parents, you're likely to repeat that cycle. Illiteracy is also a big problem. Social isolationism is a huge problem, which is a little odd when you think about it, because 92% of the families that we work with live at or below the poverty level. So they're living in extreme poverty in densely populated urban centers. Many of them multi-generationally will live under one roof. And so you think, well, with that many people around, how could you possibly be isolated? Well, you have to remember isolation doesn't just refer to having another human being around you. It really refers to connectedness. When you are in extreme poverty, you have very low self-esteem. You don't reach out for help. And even if you were to reach out for help, likely the people closest to you couldn't provide it. So isolationism is a huge component in all of this. Last year, Children's Bureau provided services to more than 28,000 children and their families through our 18 locations as far north as Lancaster and the Antelope Valley, through Los Angeles County and down into Orange County. We're very proud of that. Children's Bureau is actually the largest investor in child abuse prevention programs in the country. And it comes with a big price. All of our prevention works are paid for through private philanthropy. So all of the donations that we receive, including those that we are fortunate enough to be the beneficiary of some of your programs, go a long way towards helping support our families. There was an interesting study that was done by the Federal Reserve Bank Board in Minneapolis a couple of years ago. We've all known this, but this study was really, I think, interesting in that it pointed out for every dollar that you spend on prevention, it saves society $7 to $14 in additional services that you have to provide to families for remedial education, adjudication, the criminal justice system, the welfare rolls, health care, and treating people with substance abuse issues. So there is a financial reason, a very compelling financial reason to invest in children, especially in those early years. So Children's Bureau decided around 1990, our board really took a hard look at this and said, you know what, Children's Bureau and many other organizations around the city and the country are doing great work with families, but we're not making a big enough dent in the prevention side. So we want to try a social experiment, and that social experiment is now what we refer to as the Magnolia Community Initiative. We were already serving in Los Angeles County, not very far from where our headquarters are located now at the corner of Washington and Magnolia. And our board really shopped around, tried to find a location that we could afford, raised $22 million to build the Magnolia Community Center, which is now our headquarters, and decided that they would take out a map, draw a big square of around 500 blocks, with the Magnolia Community Center being kind of in the center of that. And then they set out to partner with other organizations, because no one organization, the government can't handle it on their own, Children's Bureau certainly can't handle it on their own. There's a myriad of other wonderful organizations, nonprofits, for-profits, civic groups, faith-based organizations, city, county, state, federal governments that are all working to solve this problem. So we tapped into those resources within this 500-block catchment area. It's a volunteer sort of wiki network, if you'll think about it like that. We developed what's called a universal intake form. So let's say a mother shows up at St. Thomas Parish because she's going there because they have a clothing center and she needs to get winter coats for her children. A counselor can actually sit down with her, go through this universal intake form, and she may determine, yeah, this woman does need coats for her children, that's obvious, but she has a lot bigger issues. Perhaps there's domestic violence in her home. Perhaps she's going to be evicted from her apartment complex and she might need legal aid or housing assistance. There's a variety of issues that she might need. Perhaps she's trying to find a job and she needs job training skills. And if she goes back to work, she has minor children and she needs someone to care for them. So through this incredible partnership of the 75 partners that are a part of the Magnolia Community Initiative, we can make sure that we address each and every one of her needs, and we can follow her to make sure that she's continuing to get the kind of support that she needs. There are really 4 pillars that we look at when we think about preventing child abuse and neglect. Nurturing parenting is a key part of that. Economic stability, good health, and school readiness. So at the Magnolia Community Center, we try and address each one of those needs. We have new parent classes. We have family enrichment programs. We have a home visitation program. We are partnering with many of the birthing hospitals around, and sadly, when a baby comes in and has a baby, sadly this happens all too often. You know, these very young girls are not equipped to deal with an infant. I mean, I can speak for myself. My first child was born when I was 31, and it was pretty overwhelming, and I had all kinds of support. For these young girls, they have very little support. Some of them may have been thrown out of their homes because they were pregnant. So counselors can come and meet with them many times before they even leave the hospital, but they continue to meet with them in their homes, and they make sure that they have the health care that they need to get better and get back on their feet. They make sure that the child is connected to a pediatrician so they get their well baby visits. And they continued with this young girl and her child throughout the first year, making sure that she understands the developmental milestones that the child should be attaining, and when they're not, can help intercede at an early time when you have the best chance of getting success. That's a fabulous program. Economic stability is a huge issue for our families. We partner with a wonderful bank called Pan American Bank. You can appreciate these minority neighborhoods are very, very underbanked. And so when they go out and they get a job and they get their paycheck, their recourse is to go to one of these check cashing facilities. And the rates that they charge are absolutely astronomical. Sometimes, you know, as low as 10% is about the lowest I've ever heard, and I've heard as high as 35%. So if your paycheck is $100 and 35 of it is just so you can cash a piece of paper, that takes a lot of money out of your pocket. So Pan American Bank actually has a facility on site. They will open accounts for these families with no cost. They will also open a bank account for them and put in the first $5 to help teach them the importance of saving and how that can compound over time. We provide financial literacy classes for those families. There's also a wonderful organization that partners with us called the Jewish Free Loan Association, and they will give microloans to people in need. So say you're a gardener and your truck breaks down and you can't get to your clients to serve them, then you're not making any money. They can come in and get the $250, $500, whatever it is they need to get their vehicle repaired. They'll work out a payment plan. They pay it back over time. Their collection rate is just under 100%, which is amazing, and really tells you something about the true character of these families. They're not bad people. They're not monsters. They just need a helping hand. They need that social connectedness, and that's what we can provide for them through the initiative. One of my favorite programs, perhaps my favorite program at the Magnolia Place Center, is our Child Development Center. If you haven't been there, you should come and visit it. It's really lovely, the work that we do there. But we have a family enrichment program, which is sort of like a mommy and me class. Only it's not just for mommies. It's for anybody who's a caretaker. So if it's a grandparent, if it's a father, if it's an older sibling, whomever it is, they actually come and they'll stay in the classroom with their child or the child they're taking care of. They learn how to get down on the floor with them and play with these children at eye-to-eye level. They learn to read to them. It helps the children socialize. It helps break down those barriers. And not only does it help the children, it helps the parents or the caregivers that are there establish some connectivity to others in their community. So they begin to organically build their own infrastructure and support mechanism. And if we can do that one family at a time, these families build communities and communities improve. And when there is stability and connectivity, the incidence of child abuse and neglect decreases substantially. I thank you once again for all of the work that you are doing, not just with Children's Bureau, but all of the organizations that you help, all the time that you spend, and I know you spend a lot of it. The personal efforts that you make are making a difference. When you put your head on your pillow tonight, you should know that you are a part of saving a child's life. Thank you.